Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Aqilah Aisyah Binti Mohamad Zaid, and along with me is Siti Umairah Binti Mohamad Shukry. Together we will be presenting our elective research project which entitles Trends of Pediatric Dental Treatment under General Anaesthesia in UiTM. And for this elective research project, it has been under the supervision of Dr. Siti Hajar Hamzah and also Dr. Alaa Sabah. As for the introduction, dental services have been introduced in Malaysia since the late 60s, which has been advanced to expand the dental health status of the population of Malaysia through the provision of promotional, preventive, curative, and rehabilitative dental services over the years. In managing pediatric patients, the administration of local anesthesia, sedation, and general anesthesia, or which is commonly known as GA, is an essential part of pediatric dental practice. In addition, GA is given prior to treatment to ensure the comfort of pediatric patients, which can aid the dentist to provide better standards of treatment and a higher level of care, to elevate patient stress and to increase patients' realization, or for children presented with less cooperation in the dental clinic, either because of age, maturity, or physical or learning disability. To date, there is no studies that have been done regarding the dental treatment for pediatric patients below 16 years old under GA at UiTM. Therefore, this research was carried out to identify the numbers and the type of treatment and the reasons for these patients to undergo GA at UiTM. The aim of this study is to evaluate the trends of comprehensive dental treatment under general anesthesia or GA for healthy pediatric patients at UiTM. As for the methodology for this study, firstly, the treatment records of all healthy pediatric patients who received dental treatment under GA at UiTM from February 2017 to January 2021 were reviewed. The patients were then divided into two groups, which are firstly the group which range from the 6 years old and below, and for the second group is the patients which range from the 6 to 16 years old. The data was extracted from the hard copy post-operative notes and soft copy post-treatment notes. The details of the patient's clinical records were extracted, such as the patient's name, date of birth, age, gender, and also race. The patient's information, such as medical status, date of operation, time of start and end of treatment, diagnosis, and type of treatment given were collected. All the hard copy post-operative GA notes and soft copy GA post-treatment notes were cautiously examined. The patient's record with inadequate clinical data such as patient's date of birth and time of start and end of each GA session were not included in the study. The treatment procedures were classified as preventive, which are scaling and fissure sealants placement, restorative, which are amalgam and composite resin compomer, glass ionomer cement and stainless steel crowns, pulp therapy, which are pulpotomy and pulpectomy for primary teeth and pulpotomy for permanent teeth, and also dental extractions. The data were then entered and analyzed using SPSS version 23. Descriptive statistics were used and an independent t-test was applied to investigate the influence of age group on the treatment duration, number of procedures, and use of various restorative materials.
These are the results of our study. In our study, there are a total of 125 pediatric patients included, in which 67 were boys and 58 were girls. The patients are then categorized into two age groups, which are less than 6 years old to represent primary dentition and 6 to 16 years old to represent permanent dentition. The mean age of the patient at the time they underwent GA was 5.77 years, plus minus 1.94 years old. The average duration of dental treatment was 62.58 minutes. However, the duration of dental treatment is dependent on the complexity of the dental treatment given. There was a significant difference in the duration of dental treatment between the two age groups. 76.8% of the patients were less than 6 years old and 23.2% were from the age group of 6 to 16 years old. As you can see from the first table, shows the distribution of treatment procedures performed under GA. This table shows the four mostly performed procedures in ascending order from top to bottom. There was a significant difference in the duration of treatment between the two age groups. The 6 to 16 years group had a significantly shorter treatment duration. Tooth extraction was the mostly performed procedure under GA, which comprises of 63.31% of the total procedures done. In this study, there were no significant difference found in all types of procedures, namely extraction, restoration, preventive, and also pulp therapy. There were also no significant difference in the utilization of composite, GIC, compomer, and compomer in both groups. However, as you can see from the second table, of number of restorative procedures by these two age groups, the use of stainless steel crown restoration was significantly higher in the less than 6 years old group. For discussion, treatment under general anesthesia is indicated for young children who need extensive treatment, are medically compromised, or behaviorally challenged. In the study, the patients that received treatment under GA in UiTM were referred for comprehensive dental treatment under GA because these patients are potentially cooperative, have behavioral problems, or planning for multiple dental extraction. Majority of the patients that receive treatment under GA are from the age group of less than 6 years old. From the data, lesser number of patients from age between 12 to 16 were treated because as the children grows older and more matured, most of them can tolerate better dental treatment. The less than 6 years old group utilized more operating time. This could easily be justified as a dental treatment for patients from this age group was mainly restorative in nature, as reflected by the greater mean number of restorative procedures and hence the longer treatment time. In this study, we can conclude that most of the dental treatment performed under GA on healthy patients were extraction procedures. Children less than 6 years of age had longer treatment under GA. Composite restoration and stainless steel crown were more frequently used in primary dentition. These are our references. Thank you.